Well, if you're a regular listener to the Less Insurance Dependence podcast, you know how strongly I feel about having a certain place in your practice management software where you enter personal information about your patients. By the way, that does not belong in your clinical notes because it will be lost there. But we need just somewhere we could catalog personal information: spouse's names, kids' name, dog's name, hobbies, interests, what college they went to, maybe important dates in their life. Maybe we know that a patient, let's say Martha is taking care of an elderly mother right now. Those are the kind of things that go in those notes. Now make sure that you are continually updating those notes based on things you learn from the patients, but also make sure your team members have access to that note field and they go into that computer and update notes. And what I mean by doing your homework each morning is to come about 20 minutes, show up into your office about 20 minutes, 15, 20 minutes before the start of your morning huddle. Look at the daily schedule and review the note cards of every patient you're seeing today, especially your hygiene patients. On your restorative patients, you may have seen them relatively recently, which is why they're on your schedule restoratively. But on the hygiene patients, it's at least 6 months, 3, 4, 6 months since you've seen them before. And for some, now because of COVID and the interruption of visits, it might be 2.5 years since you've seen them. So do your homework and just prepare for the day. Do your preparation for the day. That way, when you walk into the hygiene exam, you can say, Gary, it's so good to see you. How's your wife, Therese? Hey, how's her yoga studio going? And I have to ask you about your grandson, Kanan. And when you do your homework, and first of all, if you're not actually interested in your patients, don't do this. But Naren, I don't believe, at least this is my perception, I don't believe we have any listeners of the Less Insurance Dependence podcast that actually don't care about their patients.
I agree, Gary. And I think this is something you model, right? I mean, you are a master of setting goals. And of course, you've always said the key to goals is having discipline to work on those goals.
Discipline, consistency.
Yeah. And if you want the relationship-driven practice, this practice of showing up 15 minutes early every day, looking at who you're going to see that day, just getting familiar with, who they are and, a couple of things that you can talk to them about is so powerful, Gary.
This is all about elevating the relationship-driven aspect of your practice. Recently, a client of mine in our coaching work said, Gary, true confessions here, the larger my practice gets and the older I get, the harder time I have remembering everybody. I'm like, welcome to life, doctor. And we laughed. And I said, Doc, let me help you with this. You don't have to remember everyone every day. You only have to remember the ones you're seeing today. And all of a sudden, we were doing a Zoom meeting and his eyes got really big and he goes, oh my gosh, I can do that. So it went from the seemingly impossible task to, oh my gosh, little bite-sized piece. I can do that every day.